There are a few syndromes that occur which will be the most frequent syndromes. There's a hierarchy in the bones of the foot. There are three main bones that you have to concern yourself with: the calcaneus, the heel bone, the talus, which is a wedge of bone between the shin bone and the heel, and the whole foot rotates on that talus. Now, the most frequent thing that happens to the talus is that because of forces exerted on the foot by the body, it tends to go forward and to the side. So in general terms, when you're adjusting a foot, you'll normally be adjusting the talus backwards and medially. And that is one of the frequent syndromes. Now, the next bone that you have to consider is the cuboid. And really, the cuboid is the kingpin of the foot. Some experts say that really all the work you do, getting the heel into place, getting the talus adjusted into place, is really only worthwhile in that it makes a space for the cuboid to go back in place. Now, one of the big things about the cuboid that people don't understand is the shape of it here. If you get the heel into place and if you get the talus into place, what you're trying to do is to press that part of the cuboid nicely into its proper position. And once you do, the whole thing is nicely settled. Sometimes if you've done your work properly and you're doing this manually, you'll hear a very nice click where it all goes back into place, and the patient will instantly tell you, oh, my foot feels totally different. Now, you won't always get an audible click, and don't expect it. You're not expected to be an academic or to have an academic knowledge of the foot. In our terms, it's not necessary. If you follow the protocol that we teach you, you will know enough to get most feet back into order. Now, another thing to consider is that in general terms, the foot is supposed to be as flexible as the hand. And the fingers of the foot are these bones here. And in most cases, you're going to find that some of these are not moving. So what's not moving? What's not moving is the joint between this and these bones here, the arch of the foot. Now, this is the bottom of the foot now, the bottom of the foot. So you have been testing these. You find, we'll say, that the fourth is not moving. Now, if you find that the fourth metatarsal isn't moving, you go up to where it joins the arch of the foot, and you'll find a sore spot, and that's where you adjust. One of the most frequent things you'll see is that the second, for example, is not moving, and you'll find a sore spot up here where it joins the cuneiform bone. And when you find the sore spot, you get the person to move the foot. The foot must be in motion while you're adjusting it. And when you've done that a few times, you'll find that you're getting movement in those segments where you weren't getting movement before. Now, also up the other end of the metatarsals up here, we call these the pads. If you go along here, you'll find sore spots in the pads where these are blocked, where these junctions are blocked. And again, it's the same procedure.